Getting vaccinated against human papillomavirus, HPV, and hepatitis B virus, HBV, is one of the most powerful and direct ways to prevent several of the world's most common and deadly cancers. These vaccines don't just reduce cancer risk, they actually prevent the initial infections that cause cellular changes leading to cancer, making them a unique and proactive form of cancer prevention with long-lasting benefits. HPV is the most common sexually transmitted infection globally and a leading cause of cervical cancer, which remains a major cause of death among women in many countries. HPV is also responsible for most cases of anal, vulvar, vaginal, penile, and oropharyngeal, throat, and mouth cancers. High-risk HPV types 16 and 18 alone cause about 70% of cervical cancers. The HPV vaccine, when given before exposure, ideally to preteens but effective for adolescents and young adults as well, prevents infection with the high-risk virus strains most likely to cause cancer. By blocking the initial viral infection, the vaccine stops the cascade of events that can lead to precancerous lesions and invasive cancers years or even decades later. Clinical studies and real-world data show that HPV vaccination dramatically reduces rates of HPV infections, genital warts, and precancerous cervical changes, providing strong evidence of its long-term cancer preventive power. Similarly, hepatitis B is a major cause of chronic liver infection, cirrhosis, and liver cancer, hepatocellular carcinoma, one of the most aggressive and fatal cancers worldwide. HPV is spread through contact with infected blood or bodily fluids, and in many parts of the world, infants or young children contract it from their mothers at birth or from close family members. The hepatitis B vaccine, which is usually given as a series of shots starting at birth, is over 95% effective at preventing HPV infection. By eliminating chronic HPV infections, vaccination significantly reduces the risk of liver inflammation, scarring, and the progression to liver cancer later in life. These vaccines also contribute to community, herd, immunity, reducing the overall circulation of the viruses in the population and protecting vulnerable people who can't be vaccinated for medical reasons. In countries with high vaccination rates, cervical cancer rates have already started to decline, and liver cancer rates are projected to follow as vaccinated generations reach adulthood. By ensuring that children receive the HPV and hepatitis B vaccines, and that older teens and adults catch up if they miss them, individuals and families take a powerful, evidence-based step to prevent some of the most devastating cancers. Vaccination is a safe, simple, and lasting investment in a healthier future, transforming the landscape of cancer prevention at both the individual and public health levels.